Mhm.
So, I am Ashley Belcher. I am the clinical interest section representative for KPA, and I am hosting the Q&A series. Today, we are going to talk to Dr. Steelsmith about how she incorporates hypnosis into her practice. So, with no further ado, I will turn it over to you, Lisa.
All right. Thanks, Ashley. I'm excited to get to share what I do with hypnosis in my sessions and how hypnosis can work in different settings and some of the new stuff that I'm incorporating trance into. So I'm Lisa Steelsmith. I own Steelsmith Psychology that I started in April of 2020. That was an interesting time as we had just gone all telehealth. So that was an interesting transition to go out on my own right at the beginning of the COVID pandemic. Right now, I am primarily private practice. I also do some disability evaluations a couple of times a week just for something different to do. And then I have taught at Spalding University. I do relational theories, and Matana was one of my students this past fall. So she can tell the dirt later. But previously, I was employed by Compass Counseling and Psychology Services, owned by Amy Greenemeyer. And then prior to that, I had worked for a little company called Green Line Wellness for a few years for Amy as well. And then prior to that, I worked at the Brook Hospital as an intake coordinator. So that's my kind of work history post-doctorate. And then I've lived in Louisville all my life. I lived for a year or two in Alabama briefly when I was a mechanical engineer, working to help a refrigerator factory come online. But that is most of my life has been spent in Louisville in various areas of it. I have two very gorgeous, spicy cats, and I have a husband that I met while I was in engineering school who is still an engineer. And when I ask him about his day, uses all these letters and words I don't understand because he manages computer systems. So I just get completely glazed over sometimes when he talks about his day. I got into hypnosis. Actually, I was just thinking about this earlier this morning. I got into using hypnotic trance kind of early on when I had a book that I don't know if I still have. It was like the stress anxiety handbook or workbook. And it had all of these different ways to help people relax and be a little more mindful. It was a little bit before the mindfulness stuff really took hold. But within it, there was a chapter on self-hypnosis. And I practiced this on myself first to see what it would be like. And then I began practicing this with people who were really struggling to sleep. And it worked really well. And so I went to a suicide training. I think it was one of the first when it was mandated, the 6-hour training that we had to do. There was a man there who said that sleep was the most pivotal reason that people became impulsive and could take their lives based on that impulsivity. And I had been working with women who were postpartum or folks who were postpartum. And I knew that they would be reluctant to take any kind of medicine that would make them groggy or not be able to respond at night. But I knew that that was a high risk. So during a break, I asked him what he might recommend for that. And without missing a beat, he said that he would recommend that I train in hypnotherapy to help people sleep. And I was just kind of shocked that people actually trained in it. So he gave me the name of the American Society for Clinical Hypnosis, who I eventually connected with and started training with. I am really passionate about it because going through the trainings that ASH offers, you practice on your fellow students. You in turn are a guinea pig for them to practice on. And once you get that felt experience, you really start to see how effective this is in grounding, in relaxing. And I'll explain a little bit more too about implicit memory, or creating that felt sense of difference, like a better difference of that calm, safe feeling again. And as I said before, I did train with the American Society for Clinical Hypnosis. Towards the end, I'll give you all some resources about different places you can go train in. There are all sorts of training places. Not all of them are reputable. I'm sure there are places that offer 3-hour trainings and you can do hypnosis. ASH does a 20-hour training for your basic, a 20-hour training for your advanced, and they're just a 3-day weekend. So it's actually not that much time. But yeah, you just want to make sure you go with a reputable society if you're going to do it. ASH offers the basic, the advanced, and then what I'm in right now is obtaining my certification, which requires an additional 20 hours of consultation with one of their approved consultants. And he was also one of my trainers for my advanced program. You can also go for a third 3-day weekend and get all your 20 hours done. But I will say it's been really useful to go practice, go in once a month, bring in my cases, talk about what hindrances I'm running into in each case, and have that it's not supervision because we're already practicing psychologists, but it is consultancy in case of, I don't know why an intrusion is coming up for this person. Do I need to do something different in how I'm guiding them into trance? So that's been really helpful. And then finally, you can become an approved consultant. So I'll probably do that in the next 5 years too, because I really love this stuff. Hypnosis and hypnotherapy is not a regulated thing. There is no licensure for it. You just have to really make sure you're going to someone who was trained reputably, who acts ethically. And because there's a lot of, even within the reputable groups, you'll get a lot of past life stuff. I don't know how I feel about that right now. I mean, maybe I'll feel differently about it later, but I prefer the more science-based kind of training. So,
quick question.
Yeah.
So I'm curious, when you're working on the basic, advanced, and then the certification, what does your caseload look like with the hypnosis patients specifically?
Yeah. So when I was doing my basic, I was still already teaching them self-hypnosis before I did my basic. After my basic, I started introducing it to more clients, working on different things after I had become comfortable with an induction and a deepening and then the reorientation. Just with basic, you're free to fly. You can fly as much as you want to, just operating within the bounds of making sure you're not violating any consent on the part of a client. For instance, if I'm going to do a hypnotic trance with a client, they need to know that that's what's happening. I'm not just going to sneak in on them. And there are inductions that are kind of sneaky called conversational inductions. But I do mostly, my first 3 years were just helping people sleep or relax.
You sort of chose a niche area within this construct to hone those skills.
Well, my niche was already that perinatal.
Okay.
And so I really wanted, and then some of my fertility clients even pushed me beyond my comfort level because someone had a phobia of needles, but needed to give herself progesterone injections. And she was going to be alone and she couldn't get anyone to do it. And so I said, I'll try and we can see if this will help reduce your needle phobia. And we did a couple of trances and she was able to give herself injections. And so that really caught fire with me too.
So would you say that with most of the people you were working with, you were using some component of hypnotherapy?
I would say I'm using hypnotherapy right now with about 20% of my clients consistently. And then if that's part of the problems, and I've got a little slide later, but part of the problem with this is if I've had a talk therapy client for a while, I can introduce the idea of hypnotherapy to them and say it's only going to take up about 15 minutes, but often they don't want to interrupt that talk time. So sometimes it's a hard sell to get people to let me have 15 minutes to do something with them, and then we can do some more talk.
Okay.
But yeah, I would love to do it with 100% of my clients.
Okay.
It's a
I was
game.
just thinking about trying to learn something new and the need for maybe, for me personally, I kind of like to try it with a few and then let it kind of mushroom naturally. But it sounds like it's a process that you can use some component of it with many different people.
Absolutely, absolutely. Like I said, my comfort was in sleep. Then once I did my advanced training, and I wanted to do the advanced training because I have several clients that have chronic pain. And I thought, what if I can do some low level anesthesia with them? Would that benefit them? Would that enable them to then practice some relaxation exercises? If I could get their pain level to back down a little bit, or if we could get migraines to kind of back off a little bit. I have had this, so I have had luck with friends with anesthesia. I haven't had any luck with clients directly with anesthesia yet, but I'm still practicing it. So, yeah. But
Thank you.
yeah, it treats, you can use it to treat GI issues. I'm going to introduce it to a client because of really severe irritable bowel disease, and then a little bit of anxiety not a little bit of anxiety, a lot of anxiety that's growing around that. Chronic pain. I worked with a woman last fall for tobacco cessation. And then other people, if you decide to go train, there will be mostly therapists in there, but there may be 40%, 30% dentists or orthodontic surgeons or people doing anesthesia. So because
for a health psychologist or someone who sees a lot of complex health cases in their practice, it seems like it'd be pretty invaluable. I don't know how applicable it would be to like a primary care setting, but it sounds like you can do some in as little as 15 minutes. So perhaps it would.
Right, right. Or I know that some universities that are also like medical attached universities that have maybe a gastroenterology department, there are already people hiring psychologists to work with, clients that have chronic gastroenterological problems that are trained in hypnosis because it works. So, yeah.
Awesome.
We don't. So hypnosis started way back, even before Erickson. But Erickson is one of the big names in hypnosis. And so, of course, it has this huge psychoanalytic, psychodynamic underpinning of working with the subconscious, doing ego strengthening. Oh, I didn't have a bullet point there on another one, but anyway, I really appreciate all of the people that are really heavy into neuropsychology coming in. I was sharing with Ashley earlier that I do consultant, or I am consulted with by an approved consultant. He is really neurologically focused. So if I want to know how this works or what part of the brain is lighting up when, he can tell me in a minute. I did not include any of that on this slide because it would put us all to sleep. And also because honestly, I don't know it that well yet, but he really has done a deep dive into this to really understand what is happening in the brain when this happens. So, and from his view and the research he's done, it's really an altered state of consciousness that happens when trance is in effect. You've got that implicit learning that's going on that we can do in therapy, but it takes forever for people to get that corrective emotional experience or that felt sense. Like clients will always say, I already know this, but I feel like I'm just now starting to know this. And hypnotherapy gets in that. It's kind of like EMDR and brain spotting. It's just more rapid, and more rapidly generalized. And then he talks all the time about how we create or leverage neuroplasticity for that implicit learning to happen. But yeah. And Ashley, I can't see anyone's face on the screen. All I can see is my PowerPoint. So please jump in with questions or,
Yeah, I do want to invite everyone. Please do. There's a raise hand button, and I am watching that, as well as just throw things in the chat that you want Lisa to touch on if we have time. The questions that I put in the chat are definitely not a requirement for us to touch on. If there's something more pressing or a burning curiosity, please put that in the chat, raise your hand. I'd be happy to pause things and get Lisa's insight on those things.
Okay. And I'm going to rattle on, but I don't mind people stopping me midstream, okay? All right. These are the 4 stages of a trance. You do an induction, you do some deepening, you do suggestions, and these are my typical suggestions. I always these days start with safe space or safety. It just turns out that everybody carries a little bit of trauma with them. And so this work can go so much more easily if someone is able to identify with or connect to safety. And then reorienting, I don't know why the AI decided to put an ice cream cone there, but whatever. Yeah, and induction is nothing more than, there's one called a fixed eye induction, where you have the client stare above their normal field of vision and you get them to hold their eyes there. And then over time, as someone is staring up, their eyes are going to fatigue. They're going to start blinking. They're going to start tearing up. And then you may give them the suggestion, when your eyes are heavy enough, you can go ahead and let your eyelids lower. And as your eyelids lower, you'll find yourself beginning to sink deeper and deeper into trance. It's kind of, it's tricks, to be honest with you. It's little body tricks that we do. I have another one that I use mostly now, where you have someone stare up at the ceiling, you have them breathe normally. On the next inhale, you have them hold that inhale at the top. You have them hold it one more second that is comfortable for them. Then you can tell them to let their eyes and their breath go at the same time. And there is a sensation that accompanies it of the vagus nerve just shifting right into that relaxation. So all of those are little tricks to kind of begin the relaxation. And then you start deepening. Say you enter a prosody with your voice, flowing, and with every exhale, you'll find yourself relaxing more and more deeply, deeper and deeper, drifting and drifting. And at the end, if we want to, not when it's not being recorded, I'm more than happy to do a little demonstration for you guys.
Felito has a quick question.
Sure.
All right. Can you hear me?
Yeah.
Okay. And forgive me if you covered this because I had to step off to take a call. So you may have, do you do some kind of, in my brief, very limited training related to hypnosis, there was a lot of talk back then, a long time ago, about susceptibility and doing kind of susceptibility kind of test with folks to make sure that they're a candidate. And so I guess I just wondered about, before you even start, going very far beyond an intro and then trying to do an induction, do you do some kind of susceptibility kind of check with folks?
I appreciate that. And that has not been covered. The old theory was that you needed to make sure that the person was susceptible before you introduced hypnosis. And Felito's not wrong. What you would do is you would begin kind of inducing a trance with people, but it was an eyes open kind of trance. And you might say, you might notice your wrists getting lighter and lighter, lighter and lighter. Or you might alternatively say your hand becomes heavier and heavier, heavier and heavier. And someone's hand would either float up or float down, or sink down, I should say. And that would be the rapidity of that would be a really good indication of how susceptible that person was. It turns out that anxious people are highly susceptible. Anxiety itself is kind of a trance. What I do with people, I don't really do it because actually everyone is semi-susceptible. So I don't really have to do that. I do have to warn my clients, this may feel like nothing more than a guided meditation. And so you may be thinking, is this even working? I don't know if this is working. But I've let my clients know it doesn't matter. It doesn't matter if you are just rock solid deep, or if you just feel like you're listening to something on Calm or Insight Timer. The effect is still the same. High susceptibility just means this is going to go really quickly and I don't have to do a lot of deepening. Low susceptibility, there are a lot of reasons for that too. So I don't do any of that work now. I just do trance with people and kind of let them enjoy it. Also, what I explain to people is everybody has experienced trance that has been in their car, has driven to where they were going, and couldn't remember how they got there. That is trance. It's nothing more, nothing less. So that kind of lets them feel like, oh, I think I can do this. So I hope that answered the question.
It did. Thank you. Thank you very much.
Cool. I'm fine with you guys staying unmuted and shouting out questions. So you do what you need to do. These are the things I use trance for these days. I usually use it to help people reconnect to a sense of safety, to enhance relaxation and grounding for sleep issues. I did have that really good effect of helping a needle phobia. I did work briefly with a client on dental phobia. It seemed to help. I've done some analgesia and then habit reduction. And what I'm branching into now are reworking attachment traumas. So there's a way, once you've done enough foundational work, to have a person see a scene from the past where they were perhaps treated harshly by a parental figure or an attachment figure, or a scene in which they felt helpless as a child, and for them to have an ideal parent come in and reworking that scene with that ideal parent. And it's really helping people heal some attachment wounds. So I hope to get into that in the future, but I'm doing the base work now with all the safety imaging. It is suited for people from the age of 2 to the age of whatever we end at. You can do hypnosis with a child. It is very rarely a closed-eyed trance. They do it a lot for enuresis and encapresis. And they help children connect to their pelvic muscles in a trance. So, but a lot of times you're simply using the prosody of your voice in a conversational induction to just have that child imagine floating on a cloud. And once that child is relaxed, really helping them do that proprioception of connecting to those muscle groups. You can use it for anxiety with kids too, but anyone with suggestibility. And then clients who are seeking integrative care that are open to it, people that are open to experiential therapies. I've had maybe 2 clients that have said, absolutely not. I don't want to do that. That doesn't feel good to me. please don't ask me to. And that's absolutely fine. I'm not going to do that with them, even though I think it might benefit them. There are certain things that can happen that I'll explain in a minute that don't go quite comfortably during a trance sometimes. It's not upsetting because you're already in an altered state, but it's kind of having to overcome most barriers. Again, it's contraindicated if the client has not specifically consented to hypnotherapy, especially if they're highly resistant or fearful of hypnosis. I have to explain to people that when they see this happen in the movies or in a theater kind of setting, everyone who volunteers to be hypnotized is already an extrovert and an exhibitionist. And so they are the same kind of person that you could give them a couple of beers and they're going to want to take their clothes off or dance like a Vegas showgirl or something. This is not, if you don't have a burning desire to be an exhibitionist, I cannot turn someone into one. So that's just, I can't make someone clean their home if they don't want to clean their home. I wish somebody could put me in a trance and get me to clean my house. If they have psychosis or they have really severe disassociations, it's not going to be effective. And then if they have any unresolved medical issues that require diagnosis, you don't want to ever work with someone on something like pain relief or anesthesia if pain needs to be addressed first diagnostically. There's some underlying issue. So the side effects are you cannot testify about any memory that you have gone over in trance. They think, legal people believe that I can corrupt memories. Honestly, it's not me corrupting memories. It's just that memories are faulty. Memories are already flawed. They can have parts of the truth and parts of fabrication in them. So if a client does come up with a memory during trance, we try to focus more on the feeling of that memory versus the facts of that memory. We don't know if that actually happened. We just kind of go with whatever the feeling is. Other consequences are I have had people in safe spaces and suddenly the safe space would shift to a very unsafe space. The person wasn't upset by that because, again, we're very relaxed in trance, but they were kind of frustrated that their brain kept throwing them into unsafe spaces. And what I've learned since then is those are called intrusions. And that is really the subconscious not feeling comfortable with being relaxed and letting our guard down. It's kind of, hey, remember, bad crap has happened. Don't forget that. Don't relax. And so we just work with that and we work with them on safety until the intrusions stop. You always want to offer the person reputable resources to go with, to say, hey, here's who you can. I always offer to let them go to ASH and look at them. I have a couple of articles I might send to a client that's really interested in reading about the neurology of it. I try to demystify trance with that whole driving thing. You've already been in trance before, you just didn't know it. And then for people that have had severe trauma, I do more of a trauma-informed approach where next week or the next, I'm about to walk a client through an entire induction through reorienting without putting her in trance, because I want her to know exactly what's going to happen, exactly what it sounds like, exactly what it feels like. So you just want to be careful with people. And how I find clients is I'm going to be listed on the society website. I've got it on my website. But stuff gets around, people are referring people to me. I just got a referral from a psychiatrist. So, it just kind of gets around, and especially Louisville. So I think the rewards are that you see such rapid improvement. The client feels really comfortable and enjoys it. You know that it's got limited side effects. And the really weird thing about it is you get a little contact high when you're doing hypnosis with people. So every time I've been doing a hypnotherapy session, I am incredibly relaxed and focused afterwards. So that's, if you try to see a bunch of people a day and you get 3 people a day that you're offering trance to, it's really lovely to have that kind of at the end of your day from that trance yourself. The hardest part is overcoming the misunderstandings about hypnosis, trying to get clients who really want to constantly talk to give you a little room to do it, working with those intrusions. And then, ironically enough, this past year, I probably used irony wrong. I've had 2 clients that do not visualize things, that have aphantasia. So I've had to shift how I talk to people during deepening and during the safe place imagery, because they're not imaging that. I will say things more like, see the word safe, see the word secure. They can do that. The other thing I will do is that sensation of being held safely, that sensation of being supported, because they can go with other senses. They just can't go with visual imagery. So, and then these are the options for training. My consultant was like, make sure they know about FISH, which is the Florida Society for Clinical Hypnosis. He does a lot of trainings there. And you can do either American Society or Florida Society, and they will transfer to one another. So that's nice. But there are the other 3 societies that you can train with. Sorry. Blah, blah, blah. I'm going to stop sharing this now, and we can just go into talking.
Thank you so much, Lisa. That was really thorough. I really appreciate it. You've touched on a lot of the questions that I sent you ahead of time, and also we added. I did want to know, what drives your passion for hypnosis? You did cover that to a certain extent, but I am curious.
I think to be honest with you, I really like being in trance.
Mm.
I find it very soothing. I find, like, when you're doing this training, and you get to participate in it, and you get because I'm highly susceptible, my trainers always used me as an example, because they can basically say, hey, Lisa, go into trance. And I'm like, gunk, okay, I'm in trance. And then, but then, like, I had a couple of habits that I didn't like, and they were like, okay, we'll work on that habit. And in one session, I'm like, it lasted, like, the effects lasted for a month of that one session. I picked my cuticles, and he did a little thing on me about, your hands don't want to harm you, your hands want to help you. Don't harm your hands. And it was like 5 minutes long. And every time I would go up to bite at my cuticle, I would go, my hands want to help. And I was like, okay, this is good.
So you just found it useful for yourself.
Yeah.
That's amazing.
Yeah.
Incredible. Please, if anybody has any questions, please jump in.
I think I'm curious, like I said, doing mainly assessments and being a very assessment heavy person, I don't know how much hypnosis I would be doing or would enjoy doing, frankly, either. But looking at, if I have a client who I assess and I think hypnosis would be good for, and doing research on clinicians in the area that offer the service, what would you consider to be some red flags of clinicians that are like, oh, I don't know if I'd refer a client to them?
If they've had the advanced training, and I think it'll list that, I think they're great. The basic training is fine. And I was okay doing hypnosis for very limited things with that training. Matana, I think it's just, do you know this person? Is this person an ethical psychologist or ethical MFT, ethical social worker? I think ethics would bother me the most, more than anything, because you can have all the skill in the world, but if you don't have the ethics, that just, I don't like that. I would look at where they were trained. You know, if I'm biased right now, and it would be like, you know, well, already I'm biased. I'm like, do you have a PhD or a PsyD? You know, but if someone's not trained by ASH, I would feel like, ooh, I don't know. I'll think about that. Let me think about that. Do I want this person to go there?
Yeah.
What are some of the challenging aspects? What do you find challenging in doing hypnosis?
To be honest with you, and this may not, I don't know if this is going to come across to everybody. When I bring something different into the session than something I was trained in my training program, I think I always struggle with a little imposter syndrome about it. I mean, I've been doing hypnosis with people for 6 years now, and I will begin trance with someone and I'll go, oh God, what if I don't know what I'm doing? You know, and then we'll fall into trance and I'll go, oh, please, you know. I think that's the biggest hurdle for me, is feeling like, you know, that mindset we get into as psychologists, as I have to fix this, or I have to have the answer for this. And I'm really personally working on, let's see, but, you know, if I don't feel like there's harm, why not? Jane, if I already, you said something, sorry, let me do that. Oh yeah, completely, Jane. Jane asked if it was a natural extension of mindfulness. I am a meditator. I'm a Zen Buddhist. So I do meditation. And yeah, I honestly, when I'm meditating, I will go in and out of trance. I know what I'm looking at now. So a lot of times I won't go into trance because that's not useful for me unless somebody is giving me prompts to help me kind of journey somewhere. But yeah, I do find it to be a natural extension.
I was wondering kind of something similar. Do you think that the type of clinician or the type of person who's practicing it, there are certain people that this appeals to and then people that it kind of doesn't? Or did you see in your training there to be a wide breadth of people doing hypnosis?
There is absolutely a wide breadth. If you ever go to a training in person, you will see the people there that are hyper medical and hyper dental, and then very research oriented kind of people, or where that research practitioner, not scholar practitioner, but research practitioner is. And then you'll find the people over here that are like, ooh, and what about psychedelics and blah, 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 blah. And then everything in between. To be honest with you, I signed up for a training in June that is leveraging hypnosis as an alternative to psychedelics. So I'm going to be doing a full day training later in June with that.
I was wondering how it compared to when you were saying the depth and the quickness. I was wondering how it compared to ketamine and treatments similar to that.
Yeah. Ketamine, probably IV ketamine, is even going deeper. But I think that hypnosis is probably the TMS to ketamine's ECT, if that makes sense.
Mm-hmm.
So yeah.
Yeah. And there are people that ketamine maybe is contraindicated for. So hypnosis could be still access to that expedited depth of treatment for them.
A lot of times what I do too, to kind of reinforce everything, is I will record the induction and everything in session, and then I will send my client the recording of that for them to practice.
Mm-hmm. Yeah, thank you for that. That was another one of my questions. I figured you did, but go to that for sure. If there's any more questions, please let me know. We are running toward the end of our time. So does anybody have any questions? Any other questions?
It's really fun. So if you get a chance to try practicing it, it's really fun.
Awesome. Lisa, we're so thankful for you and all that you've shared with us today. And do you want to share your contact info, like in case anybody has a question?
Yeah, that's absolutely fine. My work email is infoinfo@steelsmithpsychology.com.
Okay, and I will include that in my email with the recording. Lisa, if you have any other materials or anything, feel free to send those my way, and I'll also send that out with the recording when I can get it uploaded. I believe we're going to upload it to YouTube, so that's what we did the last time. So please, everyone, have an amazing rest of your day, and thank you all so much for being here. And Matana, would you mind going ahead and ending the recording? Thank you.
Thanks for the friendly faces.
Yes, I'm so grateful for you.